welcome back to my channel. Before we get started, I just want to say if you're enjoying my videos, please give this one a thumbs up and subscribe for more. Also, if you have any personal questions that you would like me to answer, you can always message me on my Instagram at whitecoatchasing or leave a comment below. So in today's video, I'm going to talk about why I chose the PA profession versus MD, DO, NP, and PT. So I'll first kind of introduce how I learned about the profession and how I got started there. So I was actually introduced to the PA profession by the NP that I see for my own family medicine care. She basically told me the differences between an NP, a PA, and then a medical doctor. And as soon as I heard that the PA profession was under the medical model, just like, a doctor is, but there is still that patient care level of an NP, I was kind of set. So I started undergrad at San Diego State University. I joined their pre-PA club and I talked to a PA who was working as a specialty. I forgot which specialty, but then at night he was working at an LGBT clinic. So that flexibility and the fact he can do multiple specialties at once really sold me. And from that moment on, I was set on the pre-PA path. So all that being said, I never went into college as a pre-med or wanting to be an MD. From the start, I'd always had the PA profession in the back of my mind, so that was kind of my goal. However, the idea of becoming a doctor obviously did dance in my head, and when people ask you why don't you go to med school instead, I weighed out the pros and cons. So ultimately, I did not decide to go the PA route because of the schooling of, becoming a doctor. I love school, and if I could become a professional student, I would. I just really love being in the atmosphere of learning. Another reason why I wanted to go into medicine. But I just really liked, the structure of school. So to me, the idea of being in school for that many years wasn't what drove me away. The main motivator for me to go to PA school was to be able to start out practicing sooner. One of the main reasons I want to go into medicine in general is to help close that gap and help provide care for people who aren't getting it in rural areas or underserved populations. And to me, being a PA allowed me to do that and fulfill my own desire to want to help those populations a lot sooner than becoming a doctor would be. If I can go to PA school and train as a generalist and be able to switch specialties and work in rural areas and areas that really need healthcare, why not be able to choose the option that I can do that in 2.5 years versus 10 years? So obviously another really big pull of the PA profession is the lateral mobility, and you'll hear that everywhere. You can switch specialties without, extra training, and I think that's absolutely incredible. There are a multitude of reasons why lateral mobility is a really attractive quality in a career, but for me, I want to go into travel medicine for at least a little bit of my career, and as a PA, I'd be able to not only travel from different states, but I'd also be able to switch specialties while doing that. Obviously, it'll probably be mostly primary care, emergency, internal, those types of that realm of medicine, but as a PA, I'll be able to switch specialties, which will create more job opportunities as a travel PA. The great thing about this is I can be a travel PA when I'm younger and have the flexibility to do that, but then as I get older and maybe find a specialty I really want to work in, I can switch into that. And then even as I get older, and if that specialty is burning me out, I can go into family medicine where it seems it's a little bit more relaxed. So of course I know I don't want to go into PA school having my path set out for me. I don't want to have that specialty in my mind because I want to be able to enjoy my rotations and really learn from them and not go in with a closed mind. But I love that with a PA profession, I can have these dreams and I can make these plans to switch specialties and, think about the different opportunities for me in the future versus to me, I felt like as a medical doctor, when you have residency and you're, stuck in one field, I personally felt like I would get burnt out and I wouldn't enjoy medicine as much anymore if I was only in one field. The opportunity to practice in multiple specialties and learn so much about medicine and different entities of medicine is really what ultimately drew me to the PA profession. So another reason I hear people say that they choose PA over MD is the work-life balance, but honestly, a lot of the doctors I work with in the family medicine clinic had a great work-life balance. They were able to work 4 days a week, and it was just a 9 to we'd get off at 4 most of the time, and then they had a full family, traveled a lot, so the whole work-life balance as possible as a doctor too. But to me, I feel like the PA profession had a little bit more flexibility in that terms, and that's ultimately why I decided PA over MD. I've met a PA that works 2 jobs in different specialties 6 days a week, and then I've also shadowed a PA that only worked she worked 3 half shifts a week because she had just had a son, and the doctor told her that whenever she wanted to go back to her full-time position, when her son was older, she'd be able to. But these are obviously case-by-case scenarios, and these are just things that I've seen, and I'm sure there's doctors who have very similar things, but it just was a trend that I saw a lot of PAs having the same kind of trend, having that kind of work-life balance, having you know, the flexibility to work a couple jobs but still not have overwhelming hours and still be able to have a life outside of their career, which that really resonated with me. Like I've said a couple times, traveling is a huge passion of mine, just enjoying other cultures and foods and all that. I know it's a very big thing and a lot of people enjoy traveling, but it's something I want to prioritize, especially early on in my life. And I feel like as a PA, I'll be able to do that, not only with my job, hopefully as a travel PA, but I know you can also take in between your assignments as a travel PA, you can take some time off, and I would love to do some overseas traveling with that. So I just love the flexibility of that and the fact that I don't have to sacrifice my passions outside of medicine for my career. Another thing I noticed with the doctors that I worked with as a scribe, and this is not to insult them, they were all incredible providers, but a lot of the doctors seemed to have a lot more on their plate, and when they were stressed out and had other things to focus on, I noticed that the appointment times are a little bit shorter, or they tried to speed through some of the appointments, you know, like the physicals and stuff, and didn't answer as many of the questions. You know, they obviously took care of the patients and like addressed all of their needs, but they had some smaller questions or needed, you know, some explaining for some of the medications, and sometimes they breezed over that because they had like conference calls to get on, or they had like hospital, you know, obligations or other things, and I didn't notice that with the PAs as much. I'm not saying it doesn't happen, it obviously does, it depends what the person is involved in, but that's just kind of a trend I saw, that the doctors tended to have more outside responsibilities that took away from their patient care, unfortunately. As for nurse practitioner, I never really looked into it, although funny enough, the NP told me about it. That really wasn't in my mind because I knew I didn't want to be a nursing major in undergrad, and so I knew it would be much more difficult for me to go about it because I was already accepted as a bio major, and I know nursing, there's like a bunch more steps that you need to do, or you have to get admitted into a nursing program, and I hadn't. So NP really wasn't anything I looked at, to be honest. Also, I was a CNA, certified nursing assistant, and so I did get to interact with a lot of RNs and LVNs, and some of them were aspiring to go to NP school. And like after talking to them about the medical model versus like the nursing model and kind of what they learned in their process to getting into nursing school and like the mindset that they're kind of taught, I realized that although I really love that and I love the patient-centeredness of all of that, I really liked the diagnosis and the medical side of it, and knowing the why and, you know, the pathophysiology behind it. To me, learning that helped me understand the disease more, and I was able to describe it and explain it to the patient better. So aside from the fact that nursing, like going to NP school, would have taken me so much longer because I would have had to do like an accelerated nursing program or, you know, figure that out, the idea of the medical model versus the nursing model and kind of where NPs usually practice versus where PAs usually practice, the PA profession was still calling my name. To me, the PA profession is like a perfect blend of like scientific learning and then humanistic learning. So you learn a lot of the science behind everything like you do in medical school, but you know, the whole profession is very patient-centered. I think the PA profession really shows how much it's patient-centered by the required hours, you know, that you have to have. And the hours are hands-on. They're not just like volunteering in a hospital or research. You have to be hands-on with the patient, and that really shows that when people are going into that school, they already have experience communicating with patients. They already have experience being compassionate and being there for people in really rough times. So they know that when you go into PA school, you're not learning those characteristics in school. You already have those characteristics. So I think obviously being an MD is incredible, and so is being an NP, but I think PA is a perfect blend of the two, and I think that really intrigued me and made me realize that I can learn not only the medical side, but I can also learn how to really be patient-centered and how to make sure my patients feel listened to and, you know, comforted and all of that. So now for physical therapy. So I was a pre-physical therapy major. However, I was never interested in physical therapy. To me, it's just not as intriguing, and it's not what sparked joy in me as much as, you know, medicine. Don't get me wrong, I was a volunteer PT aide for 3 years, and that was extremely rewarding, and it was one of my greatest experiences, but I didn't really like the whole rehabilitation and actually helping with exercises. To me, exercises weren't what was interesting about that. What was interesting is getting to know the patient, to know their stories, and to know like the diagnosis behind, you know, their disability. So that's when I really realized that like the whole idea of diagnosing and the medical side of things was more interesting than the rehabilitation part. I loved seeing them progress and getting to see, you know, how the exercises we implemented were really helping them, and were helping them be able to walk and help them to, you know, regain function in their hands, and very, very significant things. But at the end of the day, the diagnosis and helping them on like that side with diagnosing the patient and helping treating and managing with medicines and whatnot was much more interesting to me. I just realized that exercise was not my calling. All of my classes, like in my pre-PT major, that were all exercise based or helping people learn how to do exercises, like I just didn't pay attention to. But all the ones that were people centered and how to like actually communicate with people and build rapport with your clients and all of that, that was what I was interested in. Another thing about the PA profession that's really exciting to me is the fact that it's so new, that there's so much changing about it, and you can help be at the forefront of these changes. You know, you can be a part of the organizations and you can vote and you can help make these big decisions, like changing the name of the profession. Like that's such a cool thing to be able to be involved in, and hopefully as a PA I'll be able to get involved in those and go to conferences and, you know, step up in those types of leadership positions. I also knew I was a person that didn't mind explaining things. I love mentoring and I love, you know, helping people, so I think the PA profession, since it's so new and you do have to educate people on it, I think I kind of like that. I like the idea of bragging about the profession and explaining it to somebody and help educating people to know what the PA profession is, so the next time that they go to the, you know, the medical office, they're like, oh, I know what a PA is, you know, and they're not saying like, oh, well, I don't know what a PA is, so I don't want to see one. So I think being able to be that person that explains a profession to somebody was very exciting to me, and it's something I think I would love to do. And like as like a pre-PA peer mentor, there's a lot that, you know, for med school, there's a lot of resources. Since the profession's so new, I think there's just so much information out there, and people, you know, are thrown like different facts and like, you know, misinformation, or things are rapidly changing. So I love to be able to be a part of someone's journey and help them discover the PA profession and like how to manage becoming a PA. So I think since that's newer and there's not as much information out as medical school, I think it's a really good opportunity if you have that mindset that you like to mentor, you like to help people. I think it's a really good place to be able to do that. And also I was thinking about later on in my career being able to teach, and since there are more PA schools popping up, which could equal to more teaching opportunities, I think that would be something I would really like to do in my future, because like I said, I like helping people and helping them connect dots and be able to understand things better or see them go along their path. That's like really rewarding to me. So I think teaching would be a great opportunity, and like I said, there's more PA schools popping up all the time, so hopefully when I get to that point in my career there'll be a teaching position open. So yeah, basically the rundown, I chose PA over MD because I felt there was more flexibility in the career and in terms of being able to integrate my outside, you know, hobbies and whatnot into my life, and have a good work-life balance. I also liked the idea of being a travel PA and being able to switch specialties while doing that. And then ultimately just came down to time and being able to get out there in the field much earlier than MD does. And I know there's different scopes of practice, but for me, what I want to do, a PA is perfect, and 2.5 years is a perfect time for me. I really feel like that'll be enough training for me to do exactly what I want to do as a provider and help get that care to those rural areas. And then I ultimately didn't choose NP because that really wasn't at the top of my mind, so I wasn't preparing for that. I don't have any nursing credentials or anything, and it would have taken me way longer to get to NP than to PA, and just ultimately I like the medical model more than the nursing model. And then PT, I just really was never interested in it. It's really great, they do incredible things to help people out, but at the end of the day, the diagnosing, treating, and managing medications and all of that was much more interesting to me. Alright, so that is the rundown of why I chose PA over MD, PT, and NP. If you have any specific questions about like each profession and why I didn't choose each profession, you can always message me on Instagram at whitecoatchasing or leave a comment below. Thank you so much for watching and hope you have a great day. Bye!